Good evening. I am Dr. Udaysinh Mane, MD Medicine. I am practicing in Islampur. Today we are going to discuss about heart attack. In today's session, we will see the causes, different symptoms, preventive measures, and the treatment of heart attack. Nowadays, we are seeing that many patients are dying because of heart attack, and even patients with the younger age group, like 30, 40, are coming with the heart attack. And number of deaths and complications due to heart attack in India are continuously increasing. So what is the reason behind heart attack? We have to understand the pathophysiology and the causes behind this heart attack. So heart is a very essential organ, and non-stop functioning of the heart is crucial for survival. Heart basically functions as a pump which allows the circulation of blood throughout the body through the extensive network of various large blood vessels. And blood ultimately provides nutrition and oxygen to various organs and tissues, which is required for normal functioning of the particular organ. Muscles of the heart are continuously contracting and relaxing to pump the blood into the blood vessels. Pumping of the heart leads to what we can hear as a heartbeat. On an average, heart contracts and relaxes for 72 times every minute. To do such a extensive work non-stop without any interruption, it requires continuous supply of oxygen and nutrients to the heart. So heart has its own network of blood vessels, which are right coronary artery, left coronary artery, and its various capillaries, which provide continuous blood supply to the various heart muscles. Any interruption to the blood supply and obviously oxygen supply to the heart muscle can lead to impairment of the function of the heart muscels, which lead to heart failure and heart attack. Basically, heart attack occurs when the blood supplying the heart are blocked because of various reasons. Now let's understand why there will be blockages in the blood vessels. The main reason behind such incidences is high blood pressure and excessive cholesterol and fat deposition in the blood vessels. Persistent high blood pressure damages the blood vessel by making them more rigid and stiff and damaging their inner walls. This increases the risk of cholesterol, which is increased in obese patient, and the fat gets deposited into the walls of the blood vessels. And this there is extensive fat, it gets deposited under the inner wall of the blood vessels. This lead to blockages and fatty streaks in the blood vessel walls. Due to these blockages, heart of the person with a high blood pressure has to work harder to pump the blood throughout the body, and there is increased demand of nutrients and increased workload, and there is decreased supply because of increased fat and blockages. So increased demand of work and decreased supply of oxygen can because of blockages ultimately lead to heart attack and heart failure and failure of function of the heart. So heart attack, now we'll discuss about the symptoms of the heart attack. What are the symptoms which commonly present a patient presents with the heart attack? So main symptom is chest pain. Basically, commonly there is crushing sensation, pressure and squeezing sensation in the chest, center of the chest and left side, which can radiate to the neck, jaw, back and upper abdomen, sometimes upper abdomen. So there can be sometimes the patient is diabetic, and there may not be typical chest pain as presenting as angina. Patient may complain of only breathlessness, dizziness. Uncommon symptoms are there like burning feeling in the chest, shortness of breath, and nausea, indigestion, vomiting, breathlessness, dizziness, and fainting can occur because of low blood pressure, which occurs during heart attack. So heart attack is a medical emergency, and heart attack can only be diagnosed by medical test. So symptoms suggest that the patient may have heart attack, but we have to do certain tests to confirm that whether the patient is really having heart attack or not. So what are the basic tests to diagnose the heart attack? The common tests are electrocardiogram. 12-lead electrocardiogram gives location and extent of the heart damage of the heart muscles because of the blockages. It also gives indications of what is the rate and rhythm, whether there is any arrhythmia because of heart attack, any complication because of heart attack occurring. This is also seen, can be diagnosed with electrocardiogram. Then there is echocardiography, which is basically a ultrasound of the heart. This gives the information of the thickness of the heart walls, then the dimensions of the dimension and diameter of the chambers of the heart, different chambers, then any complication like valvular damage or any puncture of the rupture of the wall, pre-wall leading to pericardial effusion. Then it also gives indication of decreased movement of the particular part of the heart which is ischemic. So basically, when there is blockage of the artery, that part of the heart pumps relatively less. So this can be seen on your echocardiography, and this sometimes the ECG may be normal in initial phases. Patient is having typical symptoms, and echocardiography may diagnose the decreased movement and obviously ischemia of a part of the heart. Then there is a definitive test which is called as coronary catheterization or angiogram or angiography. This is done through femoral artery or nowadays from a radial artery route, and the catheter is introduced into the aorta and origin of right and left coronary arteries, and the dye is injected through this origin of the arteries, and X-rays are taken from different views. So this test gives the exactly where what is the size of the blockage, location of the blockage, whether the block is discrete or diffuse, and it also helps for the treatment, whether bypass is required, medical management is required, or angioplasty is required. So there are some blood tests which indicate that the patient is having heart muscle damage, because when the heart gets damaged, it releases certain enzymes into the blood like CPKMB and then TROP-T, TROP-I, and LDH. So this test can be done, and sometimes we can do blood sugar, and high cholesterol levels can be detected, which gives indication that the patient is having underlying causes of extensive heart attack. So heart attack is a medical emergency, and minute means muscles. So we have to treat very urgently. We have to diagnose the patient on the basis of his symptoms and some certain tests without lapse of time, and we have to start the treatment as early as possible. So what are the medications which are used in the setup of heart attack? The drug therapy aims to break up the clot and stop the platelet from collecting and sticking to the cholesterol plaque, and stabilization of the plaque, treatment of different complications like arrhythmias, and prevention of further ischemia. So some medications are to be taken as early as possible within 1 to 2 hours of the start of the symptoms of the heart attack. These are antiplatelet drugs like aspirin, clopidogrel, prasugrel, ticagrelor, which prevents the aggregation of the platelets which is occurring at the site of rupture of a fatty streak in the coronary artery. Then there is antithrombotic treatment like heparin, which prevent the further clot formation in the coronary artery. And the main treatment is thrombolytic therapy, which involves the injection of streptokinase or tenecteplase, which lead to dissolution of the clot in the coronary artery. So sometimes the patient may have failed thrombolysis, and patient may require a primary angioplasty. That is, directly patient is taken into the cath lab, and the culprit artery is found, and the clot is extracted from that vessel, and the block is dealt with angioplasty. That is placement of a stent or drug-eluting stent mostly into the site of the blockage. So thus, drug therapy prevents the blood clot from formation. It stops the platelet from collecting and sticking to the plaque. Then there is stabilization of plaque. So atorvastatin and HMG coenzyme reductase inhibitor drugs like atorvastatin, rosuvastatin are used to stabilize the plaque and prevent further ischemia. Heparin is useful to prevent the further formation of clot and prevent the further ischemia. Then there are some drugs which are helpful in the setup of complication like decreased blood pressure, then high blood pressure. Then there are certain drugs which prevent the arrhythmias which are occurring in the setup of as a complication of acute heart attack. So take this medication as soon as possible, 1 to 2 hours within the starting of the symptoms, as early as possible. So how can we reduce the risk of heart attack? This is primary prevention. So primary prevention is very important. Prevention is better than cure. So we have to avoid this epidemic which is occurring in Indian setup because of high fatty diet. Then there is a decreased exercise, so patients are getting obese and they are having mild hypertension, central obesity, diabetes, and ultimately high blood pressure lead to these different ischemic events like angina, heart attacks. So we have to prevent these complications. So we have to treat different causes which are present, which are responsible for heart attack. So how can we treat blood cholesterol with diet management? So food higher in saturated fat can contribute to high cholesterol level and reduce the blood flow to the and increases the risk of heart attack. Hence, it is important to start healthy diet to reduce the risk. So we have to limit the foods which are high in saturated fat, which comes from animal products like cheese, fatty meats, dairy desserts, tropical oils, and highly processed foods. We have to choose unsaturated fats which do not rise the bad cholesterol. And these are nuts, fish, vegetable oils, olive oil, and sunflower oils. So diet should emphasize the intake of fruits, vegetables, whole grains, poultry, fish, and nuts, and decrease level of sugary foods and beverages. Eating and drinking too much sugar raises the triglyceride levels in the blood, and it also increases. It is also responsible for diabetes and obesity, which are risk factor for heart attack. So second thing is controlling your blood pressure. So drinking alcohol can lead to high blood pressure. So we have to curtail the alcohol intake, and it also increases the extra calories into the body, and it lead to weight gain, obesity. Again, cigarette smoking raises the blood pressure. It lead to atherosclerosis. It is well known that cigarette smoking is culprit for heart attack. So we have to stop these bad habits. Then excessive salt intake also raises the blood pressure. So reducing salt intake is also important to prevent the heart attack. So then you have to maintain your ideal body weight. So we have to stop sedentary lifestyle, and we have to start walking and exercising. So what is the protocol for this exercise? That 2 hours and 30 minutes of moderate aerobic activity per week, like brisk walking, or 1 hour and 15 minutes of high intensity exercise like jogging per week. So we have to maintain regular exercise, and regular exercise is helpful for maintaining the ideal body weight and strong and healthy heart, which can pump blood with less effort, and it also reduces the hypertension and risk of hypertension and heart failure and heart attack. So it is important to remember that we can afford everything, but nothing is precious as our health. So it is possible to make healthy heart and prevent heart failure and heart attack through lifestyle interventions like dietary modification and exercise. By taking action to lower the blood pressure and decreasing cholesterol, one can help to protect themselves against the risk of heart attack. So in summary, there is epidemic-like situation of coronary artery disease and heart attack in India. Young patients are being involved. So the basic culprit is a lack of exercise, sedentary lifestyle, increased consumption of alcohol and tobacco, increased consumption of salty diet, high fatty saturated diet. So this all should be avoided, and regular exercise and healthy lifestyle, healthy nutrition, and then meditation and relaxation of mind is very important to prevent formation of plaques in the coronary, and which can ultimately lead to heart attack. Thank you.